Hello friends, I am Dr. Shweta Jain from iMantra. In a quest to constantly make you aware about the health of the eyes and various diseases which are common, today I am going to discuss on risk related to cataract surgery. Although cataract surgery is a simple and low risk procedure, there are still some risk involved. But before we talk about the cataract surgery risk, let's first understand what is cataract surgery. Cataract surgery is used to treat cataract, which are cloudy looking lenses that develop in the eyes. Cataract can cause vision problems including blurry or fuzzy vision and blindness. The procedure for this surgery is done by removing the cloudy lens from the eye and replacing it with a clear artificial lens implant. Cataract surgery risk. These risks can increase if you have other health conditions or issues such as diabetes, glaucoma, high blood pressure, etc. The risks related to cataract surgery are much more common with mature cataract against the immature cataracts. First, let's talk about the general surgical risk. Risk related to anesthesia being used during the surgery can cause vomiting, nausea, irregular breathing, allergies to medications, etc. However, the risk of these is very low if the proper care is taken. But the good news is 99% of the cataract surgery these days do not require any anesthetic injection and can only be done by putting anesthetic drops or ointments on the eye before the surgery. Next, let's talk about the specific risk related to the cataract surgery. The risks with this type of surgery are very rare but can happen anytime. These include swelling in the cornea. Even after proper preparation of the eye for surgery, complications like swelling in the cornea, which is the clear layer on the front surface of your eye, bleeding inside or outside of the eye can occur. If this happens, it can cause blurry vision when you see with your eyes after the cataract surgery. But all these complications mostly tends to settle with medication and drops within a few days. Infection. There is a risk of infection after any surgery performed on eye. Infection that occur after cataract surgery are usually very rare but can happen anytime during or even after surgery. A possible way to prevent an infection from occurring is by using antibiotic eye drops for some time, about 2 to 3 days before surgery and for about 3 weeks after your surgery. Most doctors also prefer to give their patient a 5-day course of antibiotic tablets as well. Not only that, post-op care in terms of lid and eye hygiene also plays a significant role in preventing any infection in the eye. Special care needs to be taken to control diabetes and hypertension because these conditions significantly increase the risk of infection in your eye. Bleeding inside the eye. A large bleed known as suprachoroidal hemorrhage can develop rarely after or during the cataract surgery. It is thought to occur in 1 in 10,000 patients. The chances of it happening are reduced if your blood pressures are not too high. Inflammation of the eye. Swelling around the eyes or even within the eyes itself can happen anytime during or after surgery. You will be asked by your ophthalmologist to use special eye drops called anti-inflammatory medications to help with this post-surgery swelling. Persistent swelling at the back of the eye is called CME or cystoid macular edema. This can drastically reduce your vision post-cataract surgery. Thankfully, it often subsides with the time and use of anti-inflammatory eye drops. This condition is often seen in patients who already have some edema at the back of the eye due to diabetes or other systematic condition. Distortion or double vision. It is possible that you may feel changes like distortion and double vision, which usually corrects themselves within a few days, but it may take longer for some people before your normal vision returns after cataract surgery. A change in pressure inside your eyes can also happen anytime during or after the cataract surgery. This is usually temporary and may not cause any problems for you in the future if cared for properly during the recovery period. Iris prolapse. This can occasionally occur when the colored part of the eye, called iris, comes out of the incision after the cataract surgery. In most cases, it doesn't lead to any long-term problem. It usually requires a minor procedure to push back the iris which has come out. Headache. A headache can be a possibility if too much pressure builds up within your eye itself during cataract surgery. If this happens, it can also cause nausea and vomiting, which usually resolves after decreasing the intraocular pressure inside your eye by using medications prescribed by your ophthalmologist. Incomplete cataract removal. It may cause symptoms such as pain, redness, inflammation, blurry vision in your eyes. If this happens, it is likely that you may need to have surgery again to remove it completely from the eye. Posterior capsular rupture. This can occur at the time of cataract surgery. It involves the rupture or tearing of the thin film called the posterior capsule, which holds the artificial IOL implant during the cataract surgery in the eye. If this happens before the cataract has been taken out, fragments of cataract can drop to the back of the eyes. It can cause blurred vision, inflammation, and even retinal detachment. The chances of such complications are higher with complicated or mature cataract. Dislocated IOL. The IOL is the artificial lens your doctor puts in your eye during the surgery. It can slip out of the place, causing blurred or double vision. It can also lead to more serious issues like bleeding and swelling. You may need surgery to get it back to the position or put a new one. Secondary cataract. The lens capsule is a structure that surrounds the eye lens. Cataract surgery removes the front part of the lens capsule but leaves the back in place. That's where you get a secondary cataract, also called posterior capsule opacification. When that happens, your vision may get cloudy again. It can occur from any time between 6 months to 6 years after cataract surgery. To fix it, you need a procedure called YAG laser capsulotomy. Your doctor uses a laser to create a hole in the back of the lens capsule so that it lets the light to pass through so you can see normally. It's painless, takes about 5 minutes, and is completely safe. This happens to everybody who has had cataract surgery and is a natural process. Dysphotopsia. This causes you to see visual effects, and there are two types: negative, which causes you to see a curved shadow at the edge of your vision, or positive, which can make you see halos, starburst, flashes, or streaks of light. Doctors don't know why it happens, and it often goes away on its own. It's more likely to last when it's a negative kind. Typically, you wait for it to get it better. You might try eye drops or even glasses with thick rims so you don't notice the shadows. Droopy eyelids. Droopy eyelids is another risk that may happen during the cataract surgery or sometime after it due to an injury sustained to the nerves around the eyes, which can also lead to double vision. Using medication prescribed by a surgeon can help reduce these side effects. Light sensitivity. Light sensitivity is another risk that may happen during the cataract surgery or sometime after it due to an injury sustained to the cornea during surgery, which can also lead to inflammation in that area of the eye. Using medication prescribed by a surgeon can help reduce these side effects. High eye pressure, also known as glaucoma, is another risk that may happen during cataract surgery or later. Using medications prescribed by a surgeon can help reduce these side effects. Floater and flashes of light. Surgery can cause posterior vitreous detachment, where the vitreous separates from the retina. It makes you see moving spider webs and clouds in your vision, along with flashes of light. Usually it gets better on its own within a few weeks to months, but do let your doctor know about them, as they might be an indication of something serious occasionally. Retinal detachment. It is very uncommon but serious complication, where the film at the back of the eye can tear and peel away. It usually requires urgent surgical correction. Now let's learn how can you minimize the cataract surgery risk. Proper steps can be taken care by both surgeon and the patient themselves to minimize these risks before, during, and after surgery. You should always inform your surgeon about your medical history prior to performing this surgical procedure, as it may increase certain risk factors. You should also make sure to inform your ophthalmologist about all the medications you are currently taking, including vitamins, herbal supplements, and other prescription drugs, to ensure that there won't be any unforeseen drug interactions. It is important for you to have realistic expectations of what can happen anytime during this surgery, so it does not cause any unnecessary stress. It is also very important for you to take care of yourself well in advance before cataract surgery by maintaining good health through proper nutrition, exercise, regular doctor appointments, etc., so that you give your body sufficient time to prepare for the surgery. Lastly, it is very important to get yourself operated at the right time. If the cataract becomes too hard, it can increase the chances of complications suffered during the surgery. The recovery time after this surgery is usually short, especially if you take care of yourself well in advance by maintaining good health. Most people can return to their daily routines within first week itself after surgery. At the end, I will just like to infer that the cataract surgery is being performed every day in most institutions, and it has a very high success rate with the onset of new technology. People can get back to their work in no time. So don't wait and get yourself checked if you have any symptoms of cataract. Your doctor is the best guide for your condition and will suggest you the best course to follow. I hope you found this video informative and helpful. If you have any questions, please feel free to comment below or call us on our helpline number 9711115191. Please like and share this video and subscribe to our channel for more such videos. Thank you.